The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
COVID-19 has exposed real inequalities in this province. Tonight, in collaboration with Ryerson University's First Policy Response, Nam Kiwanuka hosts a conversation about how to learn from that and put equity into the formula for economic recovery. First, Canada's Chief Public Health Officer, Dr. Theresa Tam, is with us to explain why the battle against this pandemic is yet to be won and what's needed to prevent a third wave. It's Thursday, February 25th, and that's tonight on The Agenda. It's said that when public health efforts are working, nothing happens. That's equally true normally for those that lead public health institutions. A year ago, most of us were blissfully unaware of who the Chief Public Health Officer of Canada was. Now we all know Dr. Theresa Tam. She's had her guiding hand on the tiller at Canada's Public Health Agency, one of many people we've come to count on to steer us through this extraordinary crisis. And with us now on how, and hopefully when, we'll see the back end of this pandemic, from the nation's capital, we do welcome Dr. Theresa Tam. It's good to finally get you on this program. You're a busy person and very hard to book, so we're grateful for your time, Dr. Tam. How you doing?
I'm very well, and it's good to be on your show.
Thank you. We are going to start with a graphic, and for those who are listening on podcast and can't see this graph, I'll just go into it in some detail. It starts a year ago, of course, March 2020, when we first got our first cases of COVID-19 in Canada, a little bump up in May, and then as the summer came, things started to settle down a bit, but then the graph goes up. And we get to the fall and now in the winter, and the numbers are up and up and up. But then they start to come down a little bit. I guess our mitigation measures are working. And here we are in March of 2021, and we see where the lines go under three different scenarios. If more public health measures are lifted, the line goes straight up to heaven, meaning lots of cases. If the current public health measures remain, we still likely get a third wave, according to this graph. And if stronger public health measures are enacted, then we do seem to be able to flatten the curve. So I guess my first question is, in two of these three scenarios, it looks like the worst is yet to come. Is that right?
Well, in the modeling session that I participated in, we actually had two graphs. The one that you're showing right now is the one that could possibly take place if variants of concern, virus variants that are more transmissible, gets in and spreads amongst our population. So that's what you're looking at. There's a previous graph which shows what happens when you don't have the variants. And in fact, the measures that we're doing right now has helped a great deal. Canadians is a lot of collaborative measures as well as different levels of government to bring our epidemic curve on a downward slope. We're sort of 2/3 of the way down. We're not actually all the way down the side of that second resurgence. If variants take hold, and in this particular curve, if we assume that if they're 50% more transmissible, so that are the scenarios that can happen. And, people question, well, is that likely or not to happen? Well, we've been trying to increase our laboratory detection for the variants of concern there are several of them. There's three in particular that we're tracking right now. And we do know, for example, in Toronto, that the proportion of the laboratory samples that are screening positive of some of these variants are increasing. So that is the current concern right now. If these variants take hold, if they're 50% more transmissible, if we let our public health measures go, different scenarios can happen. And what you're seeing are some of them. Are they realistic? Well, I'll just point towards one example of what's just happened in Canada. the province of Newfoundland and Labrador that has done extremely well with almost no cases. A variant comes in, and in a matter of days, they've had to deal with a rapidly spreading outbreak. And in Europe, you always have to look at lessons learned from other countries. There is an epidemic curve for Ireland and for the United Kingdom that looks very much like one of these upwardly projecting straight up kind of curves. So this is the kind of scenario that one has to prepare for.
No, I understand that vigilance is extremely important, and obviously those are your numbers and your projections that we just put up on the screen a little while ago. And I'm going to ask this next question, and you're just going to have to take my word for it that I'm not trying to get you into starting a fight with any political level of government in this country right now. I'm really just trying to get my head around this, because clearly with the scenarios that you've just described, we need to stay sharp. And yet we do see that in the province of Ontario, while Toronto and Peel and North Bay, I gather, are still locked down pretty tight, there are other regions, even in the Greater Toronto Area, there are other regions that are beginning to open up some more. I can drive 15 minutes north of this studio, and I can eat indoors, I can go to a gym. That's starting to open up. Does that not feel counter to what you're recommending right now?
Yeah, so obviously Canada is a big place, different disease activity in different areas, but you absolutely have to be really careful with easing up measures right now, because we do know that particularly the B117 variant is in many different areas of Ontario, as it is in different areas of Canada. All 10 provinces have spotted this particular variety, if you like. And so if jurisdictions, local areas are going to ease up, what they have to have are the counterbalances to tackling this virus. They need a testing capacity that has to be really well ramped up. We also are advocating screening using more tests. Well, for example, some of the newer technologies in rapid testing to screen certain high-risk settings.
So to the best of your knowledge, would they have any of those things in York Region or Durham Region or Halton Region?
I don't know, because that's in the local jurisdiction. In the federal level, we're supplying provinces with tests and guidance. And also we're partnering with different private sectors. Tests are not the silver bullet. Tests gives you another layer of protection, but you do need a good testing capacity. We're ramping up the testing for the variants. Ontario has ramped up to try to screen 100% of the lab positive samples for the variants. That's a good thing, but you got to test enough people and not miss cases. So with that, some of these screening measures help really make sure long-term care homes, senior residents are very well protected. That's absolutely key. Secondly, contact tracing. Do you have enough capacity? It is, to do contact tracing fast so that the contacts can be quarantined. So that's a capacity issue. And can you safely support the safe isolation of those who need to be isolated or quarantined? That's an important concept, because we need the public to be on board, to show up for testing or to participate in screening. That if they are potential contacts, they need to pick up the phone and get back to public health and get themselves quarantined. And if they don't have the means, or their household isn't suitable for quarantine, try to access a safer quarantine spot.
Those are all really good questions. Do you have the answers to those questions?
That's up to the local public health. If you don't have that all in place, it's really difficult to ease up.
Okay.
The other thing to do is
go ahead.
Spot the rise. So if you start seeing cases go up, immediately investigate, particularly what we call super spreading events, like there's a cluster of cases. Absolutely investigate that really fast and put a lid on it. That is the concept of trying to keep the numbers low. So the critical question to all areas is whether you're able to detect and then manage so that these numbers are kept low. Because if a variant then takes hold, it's a bit like sort of adding in an accelerant to the, putting a bit more gas to this virus, and they can take off like it does in other countries.
From all the experts I've talked to, the long-range solution to this, at least part of the long-range solution to all this, is making sure that a lot of people get the vaccination. And we want to put another chart up right now just to give you and our viewers an indication. Well, you know all this already. But here's the international race to vaccinate, and this is measured in doses per 100 people in the population. And we've all heard that Israel's doing extremely well. They're right up there at the top of the chart. The Seychelles, the United Arab Emirates, the United Kingdom, the Maldives, United States, Bahrain, Serbia, Chile. Along we go down the list. We got to keep going a long way before we finally get to Canada. We are apparently 43rd on this list. And I'd like to know what goes through your mind when you see a G7 country like Canada lower on the list than Malta, lower on the list than Turkey, lower on the list than Morocco. I don't mean to criticize those countries, but should we be this far down the list?
Well, I think first of all, just to look back, as you just said, vaccine is an absolutely critical tool, I think, in our path forward and in getting, seeing society reopen up again. So, and we are absolutely fortunate to have two very effective vaccines that are safe. So I think viewers need to understand that they are very effective tools. There has been a number of weeks where the supply hasn't been great. Absolutely. But we're seeing the supply ramping up right now. There's certainly the companies that we are getting the first two vaccines from are projecting that they are going to deliver us the 6 million doses in total that we need in the first quarter. The second quarter, much larger amounts, and then it escalates even further into the third quarter. So I think our period of drought, if you like, is just beginning to come to an end. There's always uncertainties in supply chains, etc., and that's why Canada has essentially got agreements with 7 different vaccine companies. But the first two very effective and safe vaccines are expected to ramp up in doses, and you're seeing that in terms of the numbers going up in the provinces. So I think keep our eye on the ball. Please, everyone, roll up these sleeves when you get the vaccines. Because one key concept that we have to remember is it's not vaccines that saves lives. Getting supplies, one thing. It's vaccination that saves lives. Mm-hmm. We need to ensure that those vaccines get into people's arms and that people want to get vaccinated. And, it's absolutely incredible, I have to say, that the long-term care facilities have very high uptake rates. And the North has had extremely high uptake rates in the territories. Of course, what they're just waiting, making sure that the supplies come and more and more people will take that vaccine. And I would stress that if our seniors have done so well with the vaccine, that the rest of the population to look towards their leadership, their vaccine champions, and that when the time comes, please roll up your sleeves, because that's the way that you can increase immunity to protect yourself. And we're looking to see if this also increases immunity or community immunity for the population to come.
I should follow up with this, though. Does it, and again, I'm not picking on the current government. From what I've heard, this is a problem that you can go back into time with several governments. The fact that we don't have domestic manufacturing capability for vaccines in this country, again, a G7 country, how massive a policy failure do you think that is?
Well, I am, of course, not the policy decision maker, but I think that going forward, it is important. And some of that manufacturing capacity is currently being built. There are some candidates, including one that's included in the suite of 7 agreements that we have with manufacturing Medicago, a domestic company, and other domestic infrastructures coming on board. So I do think there's a lessons learned. By the way, we do have domestic manufacturing for influenza vaccines that has a pandemic contract in place. So we need to be able to broaden that kind of capacity so that we can flexibly respond to whatever pathogen comes along. And there will be another pandemic coming up. So I do think that, I hope anyways, as a public health physician, that when this pandemic comes to an end, people don't forget you need to keep going with those kind of infrastructure and look at what Canada's space is in the world as well in terms of contributing to that manufacturing capacity.
I want to ask you a bit about your office and whether you felt adequately resourced to do the job that we are now asking you to do. And I guess in part I'm going back to the audit that was done a half a year ago or so, where the Public Health Agency of Canada was said to be lacking adequate scientific expertise in order to tackle the problems that we're now tasking you with solving. And in fact, I think I remember you saying you got a lot of inaccurate information over the course of the past year, which made your work even more difficult. What's your response to that audit and how it's come along now?
I'm not sure about the last statement that you just made, but let's just say that people have to sit back and remember this is an absolutely unprecedented public health event that we have not experienced for like a century. I think that every level of government, every part of this public health system is stretched to the max. And when things first started, of course, nothing can prepare for the absolute demands it has on myself, but also on all the other chief medical officers in the country. So I do think that we need to bolster up our medical technical expertise, but there's a wide array of expertise that's needed for public health to function. And for the advice that I am going to need to give, there needs to be a lot of people behind me to do that.
And has that been done yet?
Well, the agency has massively expanded for this moment in time. I have to sort of say that there's many areas of expansion. I have more, there is more expertise, but every level needs the expertise. They're not easy to find. We do have more expertise and medical advisors. But the other areas that had to be massively stood up are very operational in nature, for the borders and the quarantine service, for the stockpiling and all the demands of supplies and providing the surge capacity of provinces had to be escalated in a very dramatic way. And so it is a big stress on the system, and we're not the only ones by any means.
I want to ask you, and again, you're going to just have to take my word for the fact that I'm not asking you to dump on your colleagues here, but I'm going to use their names to help frame this question. It seems at least every week, maybe more often, we've got David Williams or Barbara Yaffe or Staney Brown or Lawrence Lowe or Eileen de Villa coming on television and saying, if we don't do this, oh my God, this is what's going to happen. And we see the new modeling and so on. And I wonder whether or not you're at all concerned that, that we're in a bit of a never cry wolf situation here. Do you worry about that?
So I'm trying to make sure I understand your question. But of course, in terms of the evolution of this pandemic, there's a lot of uncertainties. We've been learning about this virus as we go along, and it is a massive humbling experience, I have to say. So you don't know the full sort of, I guess if you look at it as a big puzzle, you don't know everything. Now, I am very, of course, in close touch with all the medical officers across the country. And, we have to communicate what we know at the time that we know it. We don't know. The modeling and the projections are based on the information that we have, and the models are adjusted based on any facts that we have to input into them. And so I think, but just take yourself back to the beginning of that second surge or wave. Of course, we said, by the way, you could get a resurgence if you don't do and follow up with public health measures and all of those things and get those capacity in place. And people seem to sort of not quite think that that was going to happen. And of course it happened.
Well, that's the thing. That's the thing I want to follow up on, because, you know, the Premier of Ontario likes to use this expression where he says, I know people are getting squirrely. And you know, of course we are. You know, this has been a year already. But I guess the question is, how many times can public health pull the fire alarm on this before people start ignoring the fire alarm?
Yeah, it is a very difficult thing for the population. But I think one thing right now, we need to focus on things that we can control. And I do think every individual, there's lots of things that people have adapted to do. And the majority of the population is following public health measures. There's definitely some who are not. But the vaccine does bring us hope. What we're saying is, even with the variants, public health measures can control them. We need to keep a lid on this virus and get the vaccine programs going. And it's not forever, but we need people to sort of continue to do what public health, listen to your local public health, so that this can take place. And the vaccines, as I said, have been effective and safe. And if we can just get that going, keeping the lid on that virus. And by the way, spring is coming. People can soon go outside more. We said, you know, avoid these closed, very crowded, poorly ventilated environments where we have lots of people that you don't know. I mean, we do think that things generally get better as people can get outside and do these other things safely.
Yes, the evidence does indicate that.
Hang on there. Yeah.
So let me ask you this then, because you've had the past year to look at what is now empirically provable evidence about what percentage of the population is going to adhere to protocols, what percentage of the population is going to get a vaccination when their number comes up. You have to factor into this the fact that we're going to be reopening the economy and society more in the months ahead, presumably as the weather gets better. So taking all of that into account, can you give us some sense about where we are? I mean, if this were a 3-act play, where are we in the play right now?
A 3-act play. I think we're probably, you know, as I say, there's lots of uncertainties about this virus, but the pandemic will come to an end. While I think it's very difficult to eradicate this particular coronavirus. So there are two slightly different concepts. Every country in the world has this coronavirus. So putting it back into its box in any near future sort of scenario is, I think, very unlikely. So, but a pandemic and its sharp peaks, et cetera, in different ways will come to an end. I actually think we're probably in the second act, but again, you know, I'll be sticking my neck out and trying to predict something, knowing that it depends on a number of factors. Let's just unpack this for a second. Yes, you have a vaccine, but how many people will take the vaccine? We hope everybody would. And then, you know, how that's really critical in the months ahead. What happens to the virus in its evolution? So do we need any, as I say, boosting of the even people got vaccinated now later on? That's still an outstanding question. Another really key point is that we're in the middle of finding out whether the vaccines protect against infection itself. There's some early signs that it can protect against infections, which means can it protect people from transmitting the virus after you got the vaccine? All those are slightly uncertain pieces that we don't know yet. But I'm hopeful that if people roll up their sleeves, the supply, you've heard the Prime Minister, end of September, everybody who needs a dose should get a dose. That will be in such a better spot to cope with any kind of, I guess, curveball this virus might throw us. Keep increasing those capacities that we just talked about. I think that before the next fall, you know, remember what we said in the summer and getting ready for the fall season? Before that next fall, we should be much better prepared and not be in a situation where we get massive upswings in resurgence and having to close down, you know, society. We need to come out of this particular wave, try not to let the epidemic get out of control again, and then gradually ease things as the vaccine are being deployed. But our models are showing that if a variant, very rapidly spreading variant takes hold, public health measures are still a must. The vaccines won't be enough for quite some time. So these are the different things to balance. But, the only thing that I know about these viruses is that you gotta be constantly vigilant and learning about it and adapt as we go. And I do think that both Canadians, the population, and the public health system have had to adapt on a very real-time basis.
Dr. Tam, it's really good of you to join us on TVO tonight. Thanks so much for your time.
Thank you for this opportunity.
Both the virus and the economic hardship that resulted from it have hit some parts of the Greater Toronto Area much harder than others. How come? In collaboration with Ryerson University's First Policy Response, we've assembled an expert panel to think about how to understand those disparities and to ensure a more equitable economic recovery. Let's introduce them, all in Ontario's capital city. Deputy Mayor Michael Thompson, Chair of Toronto's Economic and Community Development Committee. Jeffrey Schiffer, Executive Director for Native Child and Family Services of Toronto. Nakima Ray McMahon-Amna, Director of Policy and Research at the Canadian Black Policy Network. And Jennifer Yang, Health Reporter at the Toronto Star. Welcome to you all. Very happy to have you all. I know some of you, it's your first time, so it's nice to have you on the program. And just to set the table for our discussion, we do have a few maps I want to get through. So Sheldon, if you could please bring in the maps. Here's a map of the city's COVID-19 cases to date. Lots of cases in the northwest part of Toronto and parts of Scarborough. A couple of hotspots in East York, downtown, and Etobicoke, and very few cases in Midtown. We have another map here, and here's a map from the 2016 census of low-income neighborhoods in Toronto. Again, we see parts of Scarborough, the Northwest, East York, and downtown with higher percentage of low-income neighborhoods. Jennifer, I wanted to ask you the first question. We do see maps of Toronto, but obviously what's happening is not just isolated to the 416, correct?
That's right. The same patterns that we've seen playing out in the city of Toronto, where lower income neighborhoods, where more people are essential workers, more people live in cramped housing, are at higher risk of COVID-19. That's a pattern that's held true across not just the province, but the country and in other parts of the world as well. So some of these patterns you're seeing where the dark shaded parts of the map are sort of aligning with where people are also more lower income and working a lot of these essential jobs where they can't stay at home. That tends to be where COVID cases have concentrated.
And Deputy Mayor, what do these maps tell us about the unequal impact of COVID-19?
Well, I think the map tells us a lot, but I think it's really important for us to understand that COVID didn't create this problem. In fact, this problem existed well before COVID. And really what it's demonstrating to us, though, that we have to act, we have to help people. And as has been stated before, the conditions of cramped housing, the conditions with respect to many of the frontline workers who are from specific areas who are, predisposed to other issues such as lack of appropriate housing, food insecurity, lack of education, and so on. And so what it tells us is that we have lots of work to do. And in fact, we have to put not only policies in place and not only relying on government to actually do everything, but it is a collaborative approach as a society that we have to take the next step in order to address this inequality. It's intolerable that these conditions have been allowed to fester, and the pandemic has definitely shown us that there is a tremendous gap that has existed in our society that really needs to be addressed. And efforts are actually being made to address those. But at the same time, while we take these necessary steps and efforts to address them, we also have to measure for impact, because if we don't measure for impact, we will never know whether or not we're being successful.
And just to build on what the deputy mayor said, Nekima, he said that some of the conditions that we're seeing right now existed before the pandemic. The title of tonight's program is Equity, Economic Recovery, and COVID-19. What does equity look like to you?
Yeah, I think it's a great question, because equity is a word that, especially since all of the activism that we've seen over the course of the summer months, that has been tossed around a lot. But I think it's really important that we define the word. So equity for us is really about understanding that some communities have been disproportionately impacted by this pandemic. Those communities are reflected in geographic areas, but also ethnocultural communities. So we're focused on looking at the overrepresentation of Black communities in the number of COVID-19 cases. So when we think about responses and our economic recovery, equity means actually ensuring not just a one-size-fits-all approach, but targeted approaches that are actually going to address not just the crisis response to the disproportionalities we're seeing right now, but addressing the systemic issues, the root causes, the reasons why these disproportionalities have existed in the first place.
And Jeffrey, to build on what Nekima was saying, when we do think about recovery, one size fits all might not be what we're looking at. For the Indigenous community, how has the pandemic impacted the inequalities that the Indigenous community are experiencing in the city?
Sure, yeah. So, my fellow panelists have really hit the nail on the head with a lot of it. I think we're seeing Indigenous people in really dense urban environments where they need to go to work on overcrowded transit systems on a daily basis, and we're seeing rapid spread. But I think we also need to remember that this is not the first pandemic Indigenous people on Turtle Island have experienced, and there's a lot of intergenerational trauma about historical pandemics that have impacted communities. So alongside the historical issues that have been made more acute related to poverty and housing, we're seeing this secondary shadow pandemic related to mental health and, in some cases, substance abuse and family violence that is really becoming more acute in the face of this pandemic.
What you just said was really interesting in the sense that this is not the first pandemic that the Indigenous community has experienced. Why is that important for us to acknowledge?
I think it's important because we need to recognize that people are dealing with a lot of intergenerational trauma right now, and we need trauma-informed land-based tools and practices to be able to address the way that this pandemic is impacting Indigenous people. It also has a lot to do with vaccine hesitancy, right? Because Indigenous people have a very long history of, in fact, experimentation at the hands of settler medicine. And so when we tell Indigenous people now that they're a priority group for a vaccine, there's a lot of hesitancy around that because of historical trends. And so we're also working very hard to combat vaccine hesitancy right now in the community.
We were going to talk about vaccine hesitancy, but because you've brought it up, I suppose we can go there right now. A lot of the discussions that I've been hearing when we do talk about vaccine hesitancy, it's kind of in the way that the responsibility is put on those communities to not be vaccine hesitant. Nekima, how should we be approaching this conversation?
Absolutely. You're right on that the conversation around vaccine hesitancy has been really individual and has mostly focused on addressing the misinformation that is out there. But as my fellow panelists noted, in Black communities, the systemic anti-Black racism in the healthcare system has had disastrous and fatal impacts for Black communities. So there are warranted low levels of trust between Black communities and healthcare institutions. And I think, earlier in this pandemic, there were some ideas around dedicated testing centers in those communities that were disproportionately impacted by the number of COVID-19 cases. And when we were talking to folks on the ground in their communities, they were like, I'm not so sure about this testing center. Our community is already so over-surveilled by police, by child welfare intervention. This just feels like another thing that's coming into our community, and we're not really sure about it. So combating vaccine hesitancy, I think there's been a lot of work to put accurate information out there, information that's accessible, and there's starting to be some work ensuring that that information is available in multiple languages. But I think how information about vaccines is distributed is another key component. So there are many Black-led organizations like the Black Health Alliance that are working on the ground in communities to be the voice distributing some of that information because they are trusted sources of information in the community. I'm really looking forward to understanding how, as the vaccine rollout takes place and is led by Toronto Public Health, they're going to be able to partner with Black-led organizations to support some of that distribution and combat that vaccine hesitancy.
And Deputy Mayor, I saw you nodding.
Yes, I'm just nodding because she's right. And in fact, that work has already been started. And it is very important that it's the grassroots organizations that our municipality is actually working with, because they're in the community. The community members know who they are. They are a trusted source of information and so on. Let me also say that it's extremely important for members of the community to ask questions and to be hesitant about taking the vaccine and so on, because, you know, we've seen time and time again, and I know I participated on a forum last Saturday, and they talked about the Tuskegee experiment on Black people many, many years ago in the U.S. And those types of memories still linger. And, you know, with respect to the systemic nature of racism and discrimination and so on, we've heard, you know, people in the scientific community, not in Toronto, but international, who have talked about experimenting on Africans and so on. And those types of information actually is you know, cemented in people's mind and their mindset. So there is a you know, a reluctance of acceptance, and there's a trust factor. But at the City of Toronto and with our Board of Health and our Toronto Medical Health, we have recognized the need to partner and to work with community organizations, and that requires us to invest with those organizations. And we are actually doing that work right now, because that's the only way that you're going to get cooperation.
And I want to go back for a moment to the map. And Jennifer, you know, the northwest part of the city looks like it has been the hardest. Why is that the case?
So at the Toronto Star, we took a look at this question early in the spring when the first neighborhood map was released by Toronto Public Health, showing which neighborhoods had been hardest hit. And it was so striking to see that the northwest corner was really where cases had been concentrated in the city. And, you know, we asked that question, why is this? And we tried to dive in and take a look at what might be going on. So our starting point was to ask, well, in lockdown, where are people possibly getting exposed to this virus? It's at work, it's at home. And, you know, you also ask questions about access to healthcare and testing. So we kind of looked at those three areas. And what we learned was that in the northwest corner, it just happens to be that a number of issues, a number of factors are aligning to sort of create this perfect storm of vulnerability to the virus. And what are those factors? More people working in low-wage essential jobs. For example, one community in the northwest corner, Mount Olive, that has had some of the highest cases since the beginning of the pandemic, has some of the city's biggest proportions of people working in manufacturing jobs. They also have some of the highest proportions of people living in unsuitable housing. So too many people cramped into a single household. And then you look at access to healthcare. In the northwest corner, historically, some people have referred to it as a primary care desert. There's just really poor access to primary healthcare. And when we got more data looking at testing access, this was also a part of the city where testing rates were really, really low. So all of those factors aligned and put the northwest corner of the city at highest risk.
Have lockdowns had any effect in reducing the spread, Jennifer?
So lockdowns do have an impact, but what we found was that in these higher burden neighborhoods, the measures put in place by policymakers take longer to come into effect in these hardest hit areas. So we did an analysis where we looked at the first spring lockdown and we compared how it impacted some of the wealthiest neighborhoods in the city where racialized populations were lowest. And we compared it to neighborhoods that were some of the lowest income where racialized populations were highest. And we found that the first spring lockdown almost immediately flattened the curve for some of these more privileged neighborhoods. But cases, you know, in these lower income areas continued to rise for a while before they started to come down. So some of these light touch measures that will work immediately or quickly for a lot of the more affluent neighborhoods in the city and beyond, you know, those measures just take a lot longer to come into effect and are often not quite enough to really end epidemics in these areas at all, because at the end of the day, people are still having to go to work day in, day out. So additional measures like paid sick leave probably need to come into play.
And Jeffrey, we've been hearing how we're all in this together, and we've been saying essential workers are heroes. But obviously, one of the things that's not working is this assumption that everyone can work from home. What would you like politicians to reconsider around that?
I think there's a number of things, really. I think there's been lots of conversations about the importance of creating climates where people do not need to go to work sick. So I think that it's important for us to create environments where people aren't going to the workplace when symptoms are apparent. And I think it goes further. I think that really supporting daycares, I think creating safe environments in schools, and I think providing opportunities for people to go to work, safely is really critical.
And Deputy Mayor, not to put you on the spot, but I have to ask this question because I'm sure people are watching and listening to this conversation. One of the communities that we haven't spoken about are people who are experiencing homelessness, for example. And this pandemic has hit them in ways a lot of us can't even imagine. There's a young carpenter by the name of Khalil Seavright who made these little homes for people experiencing homelessness. But the city of Toronto is now taking him to court. People might want to know, why not work with him in finding a solution for people who have nowhere to stay, instead of using taxpayer dollars in a COVID environment where every dollar counts, to take him to court?
Sure. It's really important for us to understand what we are trying to do as part of our policy in the city of Toronto. We're trying to remove people from the encampment and putting them into indoor warm environment. We've actually been rather successful at that, but we know that there's a lot of people who need to be continued to be housed and to be sheltered and so on. We are focusing our tremendous amount of energy as well as resource. We're spending, for example, over $1.2 billion on providing assistance for housing for individuals who are in need. It's important also to understand, with respect to these particular specific units that you talk about and these particular housing structure that are being built by this individual, they're actually not safe. That is not my word. It is the word of the deputy fire chief. They have actually viewed it to be unsafe. And so I don't think it's a situation where the city of Toronto can actually then support this type of accommodation in our parks and in our facilities. We want to actually remove people from the street and the encampment and put them in places where they're safe and they're well housed and they're warm. That is our effort with respect to trying to deal with this particular problem. We're investing a tremendous amount of resources. We're putting a lot of staff time, and we're actually been quite successful in terms of we've removed a significant number of people from the encampment. And I think it's important for us to ensure that we provide a safe environment for all those who are in need. So when we see a situation in which it is unsafe, we cannot endorse and we cannot support.
And just to push back a little bit, because I think some people might argue that being outside in the cold during a pandemic is more unsafe than being in your own private structure or even being in shelters.
So we believe that it's more important for people to be in a warm environment where there is support and wraparound support, which is what we're actually offering. And so the notion that would suggest that these structures would be safe vis-a-vis the expert opinion, we have to follow the expert opinion. And so I don't think it's a question of not wanting to help people. It is a question of wanting to help them in a safe and humane way. And that is the approach that we're actually taking to ensure that those residents who are in need are provided with the support that they want in a warm environment where they can have, let's say, a nice warm shower, they can have a meal, and can have additional support that they need until we can provide long-term housing solutions for them.
And Nakima, I think one of the common threads in the past year during this pandemic is that a lot of problems that have existed in our society seem to be magnified on the backdrop of a pandemic. In your view, why is the pandemic impacting BIPOC communities in a more severe way?
Absolutely. So we've been having a lot of conversations with folks within our broader policy network about this. And when we started seeing all this data coming out about the overrepresentation of Black communities in the total COVID-19 cases, about the overrepresentation of Black communities in unemployment and job losses from the pandemic, folks around us were saying, none of this really feels new. In fact, it feels like COVID-19 has just exacerbated what we've already been seeing and the outcomes disparities we've already been feeling in our communities. And one of the reasons for that is that we've discussed is that anti-Black racism really serves to marginalize folks. And when you are so marginalized that you are sort of living paycheck to paycheck or on the brink, any sort of shock to your system is going to have a profound make it or break it impact on you and your ability to thrive. Before the pandemic, those shocks were really being felt at the individual level. So, you might have seen community violence in a particular community or a death in an individual family. And Black communities are really good at coming together and supporting one another. But what has happened in the pandemic is now all of these things are happening at once, and these big shocks are being felt across the entire community. And our response to the pandemic is such that lockdowns are disabling the community to be able to come together and support one another. So I think that as we think about why this has been happening, yes, it's systemic anti-Black racism, and it's the way that marginalization has made it really challenging for folks to weather all of the shocks and challenges that are coming out of this pandemic.
And Jeffrey, when we do think about moving forward and how we can build back better, a more equitable society, and given the challenges that we've been discussing in the past little bit, how does this affect our collective economic recovery?
I think every time I hear the word or the phrase economic recovery, I always ask myself, whose economic recovery are we talking about? And so I do think that we need to take a holistic perspective and start to think about populations that historically have been marginalized and that historically have been impoverished to really maintain a high standard of living for particular folks in Canada. And so I think that we've spent a lot of time and a lot of effort, rightly so, on addressing sort of the surface impacts of COVID. I think it's really time for us to start looking at some of the structural issues, some of the deeper systemic structural issues that have been maintaining inequity when it comes to Indigenous peoples and peoples of color in the city of Toronto. And for me, that requires us to focus on stabilizing these families so that they have housing, so that they have the resources that they need, and then to begin to start defining really concrete pathways to sustainable prosperity for children, youth, and families across Toronto.
And Jennifer?
I agree completely with what my fellow panelists just said. None of the issues that have put certain people at additional risk of COVID are new. This pandemic is socioeconomically driven and is also very tied to working conditions. Measures like paid sick leave are being called for in the pandemic, but have been called for a long time because people have always been having to go to work sick and choosing between, staying at home or making their rent that month. And, in the pandemic, there has been research showing that measures like paid sick leave can reduce the rates of COVID-19. There's research out of the US showing that states with paid sick leave measures have lower rates of COVID-19. There's research out of Israel showing that paid sick leave makes people more compliant with public health advice. These measures will help bring rates of COVID-19 down, but going forward, it will also enable people to work in a safe environment and to improve public health overall, because this is not the first infectious disease to come along. It won't be the last. We have flu seasons every year. So these measures really need to be looked at.
Businesses are struggling right now. And I know that a lot of people have been calling for paid sick leave. And the federal government and the provincial government keeps pushing it back to each other. But Jennifer, can businesses afford paid sick leave when they're struggling right now?
Well, I think there's a lot of research out there showing that it's a myth that it's going to cost businesses money to implement paid sick leave, because when you have a healthy workforce, you have more productive workers. And if you think about a worker showing up to the workplace sick, what's going to happen? There's contagion. They're going to spread their virus to their coworkers who may also become so sick that they will have to stay home and potentially, lose out on their check that month. But infectious diseases are infectious, so if you can't support your workers to stay home, it's going to have a bigger impact on your overall workforce. So there really are incentives for businesses, I think, to take a look at measures like paid sick leave.
And Deputy Mayor, I know that the city has a lot of challenges in recovering from this pandemic, and we're looking at the summer. We're already seeing certain events being canceled. From your view, what would be the consequences of an uneven economic recovery be to the city?
Well, I mean, we would be in the same condition that we're actually talking about now in terms of the impact and the effect that it would have on a variety of people, in particular the BIPOC community and so on. And so when we talk about, for example, paid sick leave, which is something that we've been advocating to the other governments for, we're not just simply saying that we put the onus on business owners or small retailers who have been vastly impacted by the pandemic. We're saying that governments should be involved. So it's extremely important that they are involved. Some of the things that we're actually doing here at the City of Toronto, which is extremely important for us also to demonstrate our awareness and, tangible things that we're doing. We are actually working with respect to offering training opportunities as well as buying equipment for people who are part of our program. So they have, computers, they have connections to the internet and so on. So we change this imbalance in which we are aware in terms of some of the challenges that are impacting the community where people aren't able to work at home in their computers and so on. We are trying to ensure that this unequal economic recovery that could take place doesn't take place. And of course, there's a lot of work to be done. There's no doubt about that. But it's also something that we have to recognize that governments have a role to play. The broader community, businesses have a role to play. Society in general have to collaborate and address the challenges that exist. We know where the problems are. We know what the solutions are. The question is, are we willing and able, are we interested in actually effectively bringing about the needed changes that are necessary in order to have this, inequity that exists in our society addressed once and for all in terms of moving forward? Because as been stated, we will have other pandemics and other types of major challenges, both economic, social, as well as health challenges. Are we prepared? And we should be prepared because there's no excuse in terms of moving forward.
We have less than 5 minutes left, but you said that we know what the solutions are. Can you give us some examples?
Sure. I mean, it's been said, not proper housing, lack of education for a lot of folks, the type of jobs that people are actually doing, the training that are needed. The provincial government made an announcement just yesterday about, providing free tuition for PSWs and so on. That's a really good start. There are other areas in which people will need help in terms of affording, education. It's the high cost of education is also a barrier for a lot of people in terms of getting a good education. We know that going forward, education has always been a key equalizer for many people. I am the product of good education. That's why I'm here to talk to you. That's why I'm a member of Toronto City Council as a Black person living in this city. And who the members of your panels who are people of color, for example, would say to you that a solid education has helped them. So we have to help in terms of these, regards. We have to help single mothers with children. We have to actually help their children so that they can see better and brighter days and so on. So there's a lot of work to be done. And I think collectively, we have to recognize that we have to make the necessary investment in terms of housing, childcare that's needed, as well as activities in the cultural sector and so on to help young people. We haven't talked about young people much today, but we will tell there's a 22% unemployment rate for young people in our community. The other thing I wanted to say, and we talk a little bit about COVID, we have 9% of the city's population is Black. 26% of the COVID cases are affecting this community. That's a huge problem in terms of the impact on this community. And we know why, because they're the ones who are actually doing the jobs that can't be done by staying at home on your computer and so on. They're the ones who are at risk. They're the ones who are living in type of housing that is so commingled where they can't separate. And if breadwinner is sick and don't go to work, they don't get paid. So there is the need for paid sick leave. And so one of the other things.
I want to get into. I'm sorry to interrupt you, Deputy Mayor, but I want to get into the other one, the other panelists, because we're running out of time. But I'm sure we will go into our conversation again. Nakima, what do you think of that response?
Yeah, so the one piece that I want to bring in is the Deputy Mayor talked a lot about how the Black community, we are the ones on the front lines doing this work. And as a result, I think we are the ones who should be involved in the policy solutions to support this economic recovery. I think we do a really good job at asking Black communities what the problems are, and then we develop these reports, and then decision makers go away behind closed doors, develop these solutions, and then roll them out into the community. I think Black community voices need to be at the center of not just identifying the problems, but actively co-designing and collaborating on the policy solutions. I think there's been some of that work has started, but I look forward to seeing the ways that the municipal government, federal and provincial governments are going to center Black voices in those bigger policies that are going to actually address the systemic root causes that have resulted in these disproportionalities in the first place.
And Jeffrey, I'll give you the last 30 seconds.
Thank you. So thank you, Deputy Mayor, for bringing up children. All I want to say is our limit for systems transformation and innovation is often, based on the diversity of the people that we have in the room. We've been talking a lot about equity today, and I think that we need to invest in our kids. When the recent UNICEF report card came out, it shows that Canada invests way less in our children than other countries of our size. We need better daycares. We need better schools. We need to be supporting the growth and development and economic prosperity of diverse kids, so they can enter the workforce and add to the toolkits that we have for systems transformation. And I'll just leave it there. Miigwech.
I really do thank all of you for being here today. And there's lots more to talk about. Maybe we can do this again some other time. But I do think that the environment that we're in, the pandemic, it gives us an opportunity to build back better, as they keep saying. Thanks so much for your time. We appreciate it.
Thank you very much.
Thank you.
Thank you.
And that is the agenda for Thursday, February 25th, 2021. As some parts of Ontario have now opened up, the Greater Toronto Area stayed mostly locked down. Tomorrow, we're exploring the wisdom of that. Also, our Ontario hubs check in on how getting out into nature has been good for people, but less good for the natural world. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org. And Nan will see you here tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.